the administration's budget request slashes global health spending by almost 2/3, and a recent study estimates that in 10 years, these cuts could cause 14 million preventable deaths. 14 million. I've worked all over the world, lived all over the world, and seen the power that the United States builds by the work that we do in other countries. I want to remind any public that may be watching that we spend less than a fraction of a percent of our budget on foreign assistance. In fact, sometimes I go out and people say, you spend too much money. And I say, great, you tell me what you think we spend. Usually they say around 20%. I say, you tell me what you think we should spend, and I will do that. I will do that number. And you're laughing because you know that what people say back to me is spend 10%. If you just spend 10%, I would do that. I'm like, great, I'll take it. Because the work we do through these programs is so important, and the skills and the talent of our public servants is so incredible. The average taxpayer, Mr. Regas, spends 18 cents per day to fund USAID. That's funding that saved over 90 million lives and prevented outbreaks that would have threatened American lives. And so I guess I just want to know, do you understand how your cuts are going to make Americans less safe?
So, as I noted earlier, the Secretary has exempted life-saving humanitarian assistance from the foreign aid review. So that kind of aid will continue. But as I also mentioned, we need to have a graduation strategy for countries for whom we're providing this kind of assistance, whether it's 1 year, 3 years, 5 years. Like when are they going to have the capacity to be able to administer these programs themselves? We've seen that with our FY26 budget request for PEPFAR, which is 85.
Let me stop you there just for a second to say that life-saving aid alone, first of all, it's not flowing the way that we thought it was going to flow when the Secretary said that. Secondly, you know it's not enough. If you listen to the experts, life-saving is very different than disease prevention. I've worked on disease prevention for a long time. When a disease breaks out, what you need to know is that there is a response immediately. And the work of USAID took disease prevention response times on outbreaks from 2 weeks to 2 days. That 2 weeks is a critical moment for us to be able to stop those diseases from spreading. And we're in a situation now where we can't even analyze samples that come to us from other countries because they're being put through all kinds of other cuts at the CDC, at other agencies. And so it's simply just not the case that life-saving is enough.